Let me invite now Dr. K.M. Satyanarayana from the United Nations Population Fund as the next speaker. Dr. Dhananjay?
Yeah, thank you, sir. Before starting this Satyanarayan sir's presentation, so let me introduce briefly to him. So, Dr. Satyanarayan KM is a technical specialist in UNFPA with over 3 decades of experience in population development. He has worked in various technical and management capacities in national and international settings, specifically in populations and development in the Asia Pacific regions. So, he's also a very good friend of us, and we work together with many projects like building knowledge base on population aging and so on. And with a short notice, Dr. Satyanarayan has agreed to be part of this symposium. And so thank you so much, sir, for joining this. So over to you, sir.
It is also a pleasure to have Dr. Satyanarayana in this session. He has played a very important role in one of the major aging surveys in the country, the building knowledge base on population aging in India. It created a empirical database much before other surveys came. And I also remember with gratitude when we launched the longitudinal aging study in India, LASI. Dr. Satyanarayana and UNFPA gave a lot of support in the initial years, and that helped us to develop this major project. Over to Dr. Satyanarayana.
Thank you, Chairperson. TV, it's been ages. We have been connecting, and it's good to see a lot of familiar faces, in the symposium, and I feel quite honored, for being invited, this morning to this symposium. When I looked at the program schedule, I thought I'm out of place. But then, it's very important to have a broader view and also an understanding of, what is happening, in the region, given that, China and India are going to be a major, force that will have to reckon with the demographic, transition. So, my presentation is more, broad-based, and I've tried to bring in an intergenerational, aspect to this presentation, because at the end of it, when you're making a policy recommendation or when you're proposing policy options to the government, I think it all comes down to the finances, the fiscal aspects of it. So I think I've tried to use a life cycle approach, to this, aspect, and I'm quickly going to, share, some thoughts, about it. Is it visible?
Yeah, it is visible.
Yeah, thank you. Thanks. See, basically, the working in the UN for nearly 2 decades, I think you're all aware about the 2030 agenda, and UN has defined the mega trends, and demographic shifts are going to be one of the major things that is going to be observed globally, and Asia Pacific region is no exception to it. Then there is climate change, which is also a very important issue, and you see that frequent flooding and drought and happening in the region, and global warming, rising temperature, then sea levels, all these issues are there in the Asia Pacific region, and there is going to be a lot of urbanization and migration that's going to happen, and inequalities do exist within the region, rural urban differentials and gender differentials, which are quite prominent, and the emergence of digital technologies. So these are some of the mega trends that are going to be experienced by most of the countries in the region. I just quickly, put through a slide. Global population, I don't have to talk too much about it because you always read about these things. But the interesting aspect is the 65 plus, population, how it is going to increase and what rate it is going to increase. So now, in 2020, it was around 9.3%, and it's going to be 16% by 2050. That's a phenomenal increase. And also the oldest, category 80 plus is also going to increase exponentially. So in the next, slide, just try to, see how the share of the older people has, doubled. How many years it took for various countries to double its share, and by when it's going to double. Just try to put in different countries. I'm not going through that, but the bottom line here is it took more than 50 years in high-income countries to double from 10 to 20%, and it's going to take lesser time for middle-income countries. So the bottom line statement here is, before the country became rich, it has started growing. And since you're all talking about health, life expectancy, healthy life expectancy, and so on, I think you very well, can interpret your findings. Then coming to the Asia region, how, the share is going to increase. Just plotted that, historically from 50 to, 2050, and you can see the population share of older people, how it is going to increase in the Asia Pacific region. These are, demographic terminologies that are commonly used, to plot the first demographic dividend and the second demographic dividend. And you can see how, East Asia, has achieved Southeast Asia, South Asia, and Oceania, which also includes Australia and New Zealand. So, this is how it is going to look, the first dividend and the second dividend. And, without proper understanding of the demographic dividends, I do think, a lot of statements are being, made, and, whether we are going to capitalize on the dividend, whether you're going to miss the dividend, the demographic dividend opportunity, all these things are being discussed. The other way of looking at it is through the potential, support ratio. So I've just plotted how, Asia Pacific countries are going to be in 2050. Most of the demographers, feel that a potential support ratio of 3 is a requirement to sustain the labor force. So countries below 3, you can see that how it is going to be in 2030 in the Asia Pacific region. So you need to sustain, that level so that the economy grows and the working population is, contributing, to the economy, or what structural changes are required is something that, I would, discuss during this presentation. So basically, what have been the consequences of population aging? I have tried to look more from a macro, perspective, and there are a lot of micro issues, but at this time, it's for policy prescriptions and for policy advocacy. I think you need to sound the people who are the decision makers, and for that you need real evidences. So this is something that is quite important, and these are the consequences. They're nothing new, but these are the consequences of population aging that we see in the Asia Pacific region, given that each country is at different level of aging. So So what inferences, can you draw, for the Asia Pacific region experiencing one of the most significant demographic shifts? The traditional balance between working age population and elderly is disrupted with declining fertility and increasing life expectancies. And the shift necessitates rethinking of intergenerational economy. How the resources are being allocated, the responsibilities and the care are exchanged between generations. It also raises concern about the sustainability of the social family policies, the public policies, basically the pension systems and healthcare, policies, because one of the bottom line statement that I made was, these countries have started aging before they became rich. So I think you need to keep that in mind of, how the policies will have to be framed, from a perspective, planning. So then the transition also poses, profound challenges and opportunities for the region's economies, societies, and intergenerational relationship. These are, some of the inferences, and all of you working, whether you're working vertically, looking into the healthy aging aspect of it, or broadly from a life course, perspective. I think, most of you would have done, these analysis and drawn the inferences. See, one of the emerging things in the Asia Pacific region, and perhaps, India, if you look into the vastness of India, each state by itself can be a country. And you see demographic differentials, between the northern states and the southern states, and the southern states demographically, are in a different level. And they also might be experiencing, for instance, Kerala, Tamil Nadu, Andhra Pradesh, Karnataka, they all might be experiencing, but this is something that has emerged very strongly in the Asia Pacific region. I've just tried to juxtapose population aging proportion to the current level of total fertility rate. So China has about 1/5 of their population, which is 60 plus, and the TFR is around 1. Hong Kong, 31% elderly population, and TFR is 0.73. Japan, 1.22 and 36%, more than 1/3. Republic of Korea has the lowest total fertility rate in the Asia Pacific region, and perhaps in the world, at 0.73, and has nearly 30% elderly population. And Singapore, in terms of population, not very significant, but about 20%, 1/5, and less than 1 TFR. I think, excuse me. I think this is an emerging issue in the region, and most of the countries are going to face it. Working with the UN system, and especially with UNFPA, where human rights is the most important thing. The question that I'm posing among the intellectual community here is, pronatalism has not worked. Globally, it has not worked. Many countries are thinking about pronatalistic policies here. And the other aspect of it is, when you're thinking about human right-based approaches, coercion is something, that they come up, as part of adjusting for the population aging, because the fertility has fallen down drastically in most of these countries. And what are the reasons? This is not an exhaustive set of reasons that I've tried to underline here. I think it's an illustrative sets of, reasons why the fertility has come down and why the couples are not interested to have, children. The one is the increasing economic inequalities, instability in the forms of employment, the changing gender roles in most of these countries, increased economic roles of mothers, changing gender roles and increasing economic roles of mothers interrelated, and unaffordable urban costs. Housing is quite expensive in urban areas, and migration, internal migration, rural to urban migration is going to be a major dominant stream in most of these countries. This is not an exhaustive list, but I thought these are some important reasons that we need to keep in mind, because the countries are definitely going to progress where they're going to reach a population aging, low fertility, nexus. So, what could be the policy, prescriptions, that you could, think of? These are more, macro level, but then it also requires an understanding of the micro level, the behavioral aspects, so on and so forth. So I, personally, based on, my experience of looking into various countries and reading the literature, I do think there is a need for a life cycle approach. It's good to be good to have a tunnel vision, the ministerial based approach, what usually the ministries do, a tunnel vision, a vertical vision, but there has to be a cross linkage, horizontal and vertical visioning is required, especially, when the finance ministry decides on the budget and the public policies are evolved. I think that's a very important thing. So you need to slice and look at different segments of the society and approach the problem, as a life cycle response. So the prescriptions are basically review existing, public policies and what necessary adjustments have to be made, given the, changing social economic roles, of the country, the changing gender roles, the changing roles of mothers. So you need to look into various, aspects, the social development aspects, health, education, economy, then labor, then social security policies, because it's easy to say, universalization of social pension has to be, what are going to be the ramifications of, doing it, and, how much it is going to cost. So I think you need to specifically look into these aspects and the emerging, aspects of the schemes related to what can facilitate, things. And also looking from the low fertility, perspective, what type of work and family life balance is required, what flexible working conditions are required, what safe environments are required. And this applies for the entire population. It also applies for the elderly population. It also applies for the child, because the mother is working and the contribution, women's participation in labor force is also increasing. The other micro aspects of it, as well as the macro aspects of it, comes through data intelligence. I think we will have to look into a lot of behavioral, studies, across the population segments. Then something, that has emerged, of late, although this work started several, decades ago, I think it has prominently become a major thing, and UN is involved in this exercise, which is called as national transfer accounts. I think it is an important exercise because it comes up with evidence, and it also recommends for the intergenerational allocations that need to be made, so that the adjustments and the life cycle deficit that you see can be addressed through an analysis of national transfer accounts. It is more economic, and I think ultimately it boils down to the economics of it. We all look forward to the budgets of the countries. What is the budget allocation for Ministry of Health? What is the budget allocation for Ministry of Social Welfare? All these things. But then you need to have a holistic, approach, a holistic view. So there are micro aspects as well as macro aspects, and it's a mix-up of the two. Based on that, you need to, come up with evidence for, policy prescriptions. I just take the example of China because, India too is going to follow the Chinese, trajectory of aging. Our population, India has surpassed China, but in terms of aging, I think, China has looked into a lot of policy reforms related to population aging, and now they're also facing low fertility. I think one of the things, major things that they did was the one-child policy that was there for decades. They did remove, and then there were a lot of structural reforms, that were brought in. I think, there are some good lessons that one needs to learn, which is the creation of an apex body for coordination of government departments, because the problem of aging is multidimensional. So I think, looking at it from a vertical perspective may not really help. I think it's important that the development as well as the welfare departments, work together in a holistic way. There could be a lot of, challenges in the way it works, but I think, it works in a system where different forms of, government implements, and so we'll have to see how best it can be done in different governance systems. So they created an apex body for coordination. The nearly 26 government departments were brought under the umbrella, and it was decentralized to the province level, where it was more of holistic planning, resource allocation, the implementation, research, review, everything was being done through this apex body. So they knew exactly what is going where, and this did bring about a certain level of fiscal sustainability, and the allocations were more evidence based. And broadly, this talk has been there for ages. Enhancement in retirement ages and all this, reforms were undertaken in China. The other extreme, Japan, more about it, that, Japan, the society started aging, and it was the first in the region that started aging. And here extensively, this national transfer accounts, have been used. They have been closely examining the economic support ratio. They have been looking at fiscal support ratio, which is also derived using the economic support ratio. In fiscal support ratio, it compares tax revenue received to the cost of government having to pay for public services and welfare. So I think here comes the crux of the thing, especially in terms of allocations, that are required, that are needed, and for this, evidence is very important. So the fiscal support ratio in Japan is projected to decrease from 100 in 2000 to 74 in 2050. That means there is going to be a shrinking labor force, and there is going to be a fiscal deficit. In 2020, public pension spending in Japan accounted for 1/10 of GDP. So the middle income countries or the low income countries, whether they can afford to go to the 10% of GDP for funding social pension, is something that one needs to analyze. One needs to analyze different options, extrapolate different options, and what is suited for country may differ. Countries, it may differ. So the rising expenses related to elderly for health and long-term care, combined with projected increase in public debt, has led the Japanese government implementing changes in 2023 to the social security system. So, the contributions, of people 55 and above towards the pension scheme, all those, changes, modifications, that the government, comes up with, to adjust that the debt is not high, the public debt is not high. So, I basically, summarize that, it's inevitable. The demographic shifts are going to happen. And I think there are learnings from other countries, but given the status of the economy of the country, I think we need to evolve. And for that, research is a very important component. And we also, my approach would be more from a life cycle based holistic approach rather than segmenting. Segmentation is important, but then the allocations would be based on how the society is changing. And having a short-term vision is not going to help. You need to have a perspective vision. Next 40 years, next 50 years, where do I want my country to be? Is something that is important. And as you are all aware, the silver economy is the future. So we need to start thinking. We need to advocate, and we need to come with policy options. So that the government or the policy makers in the government would understand, and a holistic public policy planning to ensure fiscal sustainability is something that emerges. So this is it sounds easy, but I think it is important yet. We need to start. I'm not very sure how it fits with the the different sessions in the symposium. As I saw from the agenda. But I think, I had to make this, statement from a macroeconomic, perspective that we need to come up with evidence. And, even I have seen, that it's important. We need to universalize old age pension. We need to have better social security and all that. We need to give options to the government, and how the government also capitalizes the first demographic dividend and the second demographic dividend is, something where we need to throw, more light and clarity. I stop here. Thank you very much.
Thank you, Dr. Satya, for highlighting the major challenges of or consequences of population aging, the demographic shift, and also the nexus between the low fertility and population aging, and highlighting need for approaching this issue in a holistic manner. And of course, you gave a good examples from what China and Japan are doing, which can also give us some idea about what many other countries who are going to face this problem. I fully agree with you. Population aging is inevitable, but its worst consequences can be avoided if we prepare very well.